You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest is an oral surgeon, and he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Nathan Schroeder. Dr. Schroeder, welcome to the program.
Yeah, thanks for having me. Appreciate it.
All right, great. I know you brought some photos, so we'll get to as many of those as we can. Now, for people that don't know your practice, like who's the typical implant patient these days?
Well, I mean, we see a variety of patients, but I'd say, the typical implant patient, when you're talking about dentures and people that are tired of loose, ill-fitting teeth, are patients that are, at or near retirement age. They want to enjoy those retirement years. They want to be able to spend time with their family and their grandkids, not have to worry about loose teeth flopping out of the mouth, be able to enjoy family meals, holiday gatherings, and they're just tired of what I call nightstand dentures, dentures that don't fit well, that they're self-conscious about leaving the house with, that they don't wear, except when they absolutely have to try to eat something as best they can with them, and they sit on the nightstand the other 90% of the time.
Is that what they tell you?
That is what they tell me. And that's what we see. So, and that term, when I use that with patients, they relate to that because that's what they're experiencing. It's probably the number one reason patients come to see us is for a loose, ill-fitting denture, in particular a lower denture. Just doesn't stay in the mouth well at all. The second group of patients we see are people that either don't have a regular dentist or have had what they call, just bad experiences with dental work in the past, where it's one root canal to the next. They have several missing teeth, and the teeth that they do have, they just don't function well with. They're looking for something that isn't going to be just one more root canal followed by one more extraction, followed by more pain and more infection. They want something permanent. They want something that's going to address the big picture, the whole problem, not just the tooth at a time approach.
Okay, good. Now, and we've talked off camera. Is this the future of dentistry? I mean, the dentures as we know them today, you think 20, 40 years might be gone? They'll always be attached to something?
Yeah, I do. I think the dentures today will be gone. I mean, and honestly, just the generation of training that I went through coming out of dental school, I'm shocked that we're still seeing patients get regular, what we call conventional dentures. I think it hasn't been the standard of care for a long time. It's not going to be it's not the standard now. It's definitely not going to be the standard in the future with the technology and that's available to patients.
Now,
today.
is this true? I mean, in certain cases, people on the day of the procedure, on the day of the final procedure, they could walk in with no teeth, walk out with upper and lower teeth that don't come out, full arch of teeth.
That's correct, yes.
And is that rare?
No, that is the standard. It's more rare that we have a situation where somebody has to go home with what I call a transitional type of denture. Maybe one of the implants just wasn't quite solid enough. We don't want to risk the long-term success of that procedure by loading that implant. So there are a few rare instances where a patient may go home with a transitional denture that they wear for a short time before it is eventually screwed in. But that's the exception. The rule is what you just mentioned, which is patient goes home with fixed teeth that same day.
That's it. How soon can they eat if everything works out?
They can eat that day, but they are on a limited diet for the first 6 weeks. We generally tell patients we want them eating food of the consistency that they could cut with the side of a fork.
Okay.
But they're able to eat. And for some of these patients with the situation that they came into us with to start, they're eating better the day after surgery than they were before they came in.
So when it's all done though, and they're healed up, could they eat like a vegetable, like bite it up, like a carrot with their front tooth?
They can bite into an apple. They can eat corn off the cob.
No matter what it
these
is?
are things that most denture-wearing patients, and if they're listening to us right now, they'll know exactly what I'm talking about. My grandpa had dentures for years, and these were all the things he feared. Can't eat corn off the cob, can't bite into an apple, can't incise layered foods like a sandwich with whatever your favorite sourdough bread. They can't do those things. But with this type of solution, they absolutely can.
So this is definitely the future of dentistry. Now, in your area, are there really a lot of people wearing dentures or headed to dentures? It's a big problem?
There's tens of thousands of people, okay? And then there's not just people that wear dentures or have partially restored mouths that they're not satisfied or happy with. There's also people who just don't seek dental care on a regular basis and are self-conscious about these things. They don't know where to turn. This is a great solution for those individuals.
So if there's so many people that are either headed to a denture or wearing a denture where you are, why aren't they all doing it? Why aren't they coming in and getting a new set of teeth supported by dental implants? What's your take?
Yeah, well, a lot of them are, and I think as the word gets out, more and more will. The big issue, and what you have to understand is once patients go through all that and they get a denture, they don't go to see the dentist anymore. They don't know that there's something better out there. So I think just lack of understanding and knowledge is one reason. The other reason is, and when I talk to patients, and even the patients that come in at first are obviously very nervous for obvious reasons, but their experience that led up to whatever brought them in the door at that point in time is usually been one of multiple dental visits, experiences of pain, multiple procedures, root canals, failed crowns.
Lots of money too.
Cracked teeth, that's right. Lots of investment of time, money, pain and suffering. And so the thought of coming back now, stepping into that dental arena that left them with a bad experience previously, and all that fear and anxiety that goes along with it, it's a daunting
it's hard to get
proposition.
Them in.
Yeah. So
especially you. You know what I'm saying? Especially you. I mean, nobody likes a dentist, right? And they know if they have to go to the oral surgeon, they're in trouble. Do you still hear that? Like, no offense, doctor, but...
Yeah, all the time. And my joke with patients is, I always smile and I shrug. And they apologize. They say, it's nothing against you. It's just I don't want to be here. And I say, I understand. It's always easier walking out the door than walking in. But I believe, with this kind of procedure and some of the technology we offer, walking in the door should be as exciting as walking out now. We have really great technology, and we have a fix for a lot of these patients that just wasn't there.
How old
before.
can you be to get this done?
There is no age restriction. I've treated patients in their 30s all the way up to patients in their late 80s.
Okay.
And so
late 80s?
Absolutely.
Why would they want to do this?
Absolutely. Well, I'll tell you a very specific story about a patient I recently treated. Initially, he came in and saw me for a consultation when he was about 82.
Okay.
And that was his response as well. When we laid out the procedure, why it would be of value to him, why he needed it. And the reason he needed it was he had a little bit of a discrepancy in his bite that he was essentially born with. But on top of that, he had lost multiple teeth. He had no molars, no teeth in the back of his jaw to chew with. He couldn't adequately chew food. That was causing problems with digestive issues, getting that food down, enjoying all those things of his elderly or his golden years that we discussed earlier, outings with family and friends and going on a cruise and enjoying the food, whatever the case may be. He was miserable. But his response, and he had been stigmatized, just much like it sounds like maybe you have, to think that, well, I'm 82, I'm at the end of my life, either I don't deserve this, or I don't need it, or it's a waste of money, or whatever the case may be. Old people, the stigma is old people wear dentures. My grandpa wore dentures, my dad wore dentures, whatever the case may be. So therefore, I should be content with dentures. And the reality of dentistry today is that is just not true. You shouldn't be content with dentures. There's much better technology out there. And so, but it took this gentleman about 3 years, 3 or 4 years to finally kind of become convinced about that. So finally, he realizes, look, I want to do this. I should have done it years ago. He comes back in, we do the full workup, and in an afternoon, after years of suffering, he walks out the door with teeth that you're just much better than he's had in decades.
Now, what if they have like a little bit of osteoporosis or they're on certain medications? Yeah. Can you work with those people?
Absolutely. The reality is most patients, in the age group above 60 and beyond, where we're treating with this solution, is they're on medications. They have these conditions. They're on these medications, and it's not that I'm trying to minimize that. I'm just saying we can work with it and we can analyze it. We have the technology with 3D scanning and imaging to assess bone volume, to assess bone density, to ensure that they're a candidate before they initiate any kind of surgical treatment at all.
So you're doing this, we should mention, on a computer. Like, you're doing the surgery first on a computer before you even do the surgery.
That's absolutely
Is that right? And that's not how it's normally done.
And I think it's underutilized technology. We do quite a bit of this. To my knowledge, we're the only surgical practice in our area that uses digital technology and workflow to the extent that we do.
What's the benefit to the patient?
The benefit to the patient is, accuracy of the procedure. You know, all of this stuff is determined on, as you mentioned earlier when we were talking about bone and where is that bone and where can the implants be best positioned. We can determine all of that up front before the patient even sets foot in the door. So we can virtually execute the surgery on a computerized version of the patient's skeleton using special software and imaging technology. We can select from a library of implants, the exact implants that we're going to place in that patient, do the procedure digitally before they ever come in physically to undertake surgery. So what that means for the patient on the day of surgery is there's no guesswork, we're accurate, and it's less surgery time because so much of the legwork and the effort has been done by the surgeon in virtual space that the amount of time that we then have to spend traumatizing tissues and doing surgical procedures in physical space is reduced. That means less swelling for the patient, less pain, less trauma, and a much more accurate, precise outcome.
Okay, you know, we've been doing this program for more than 20 years now. And every oral surgeon that I talk to off camera, he says, Randy, they got to go to an oral surgeon if they're going to do this. They need to know this, right? Do you have some, and you've never really told me that directly, but do you have that kind of a bias? Do you have that kind of a feeling? And that means if you're going to do this, you might as well get it done by an oral surgeon.
I totally agree with that. And it's not just to be boastful or prideful or beat our own chest, but you know, oral surgeons are unique in dental surgical specialists with the amount of training.
Like 10 plus years, right?
Well, when you count in dental school and residency, absolutely. Yep. And the scope of that training, but I also think one of the things that really sets us apart, and part of that training that's so extensive is in anesthesia. So one of the big advantages in just the surgical skill set and all that stuff, not to set it aside and minimize it, but when patients come to us, one of the big advantages if they've had maybe a not so good implant experience somewhere else is that we can alleviate all that anxiety and fear and with sedation.
So IV sedation?
IV sedation. We could start an IV, we can give
safe?
medication.
I mean, is it?
Very safe.
Like what do you monitor when they're?
Complete anesthesia monitoring, just like any anesthesiologist would perform in any ambulatory center or operating room. So we're monitoring heart rate, we're monitoring oxygen saturation, we're monitoring respiratory rate and CO2 output, and EKG, blood pressure, the whole 9 yards. And then we're administering an infusion of a sedative medication that makes the procedure.
And this is through an IV, right? We're not talking about a tube down there.
No breathing tube. A little nasal cannula under the nose to just have supplement some oxygen is all most patients typically need. And what is a 2-hour surgery passes by, you know, in seconds for the patient.
Is it true like they have even a bit of amnesia in some cases?
Absolutely, but the amnesia is a positive thing. It's for a short duration, and it's taking away any recollection of the unfavorable aspects of surgery, whether it's sensation of pressure or some of the sounds that go along with the instrumentation we use. Patients just don't have to be coherent for that.
Okay,
they can take that concern, set it aside, just come in, have a nice, relaxing experience, and then open their eyes and be getting teeth and be done with everything.
Now, in addition to sedation, I mean, you have registered nurses there in like a recovery room as well.
That's absolutely right. So it's all the same services you would find at an ambulatory surgical center, in an operating room. We have a fully staffed recovery room with our full-time RNs. We have a nurse that circulates in the room as we do our anesthesia. Everything is provided at the highest standard of care.
Okay, good. We're going to take a quick break. We come back, more about the process, what people can expect on day one. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
I'm just glad that I got my teeth in after what happened back in the 60s, early 60s. And I fought it and fought it. It really changed my life. I can smile now. I can eat whatever I want. Not embarrassed. So I really enjoy it.
Before I had the procedure, I would spend all the time covering my mouth like this to hide my smile. But having had the procedure, it's wonderful now to smile with confidence. All my friends and family tell me how beautiful my smile is now. I was so pleased with where I had the procedure done, and I would recommend them to anyone.
I just was the other day thinking and telling my friends what a great experience it was this summer to look at a piece of corn on the cob and say, I'm gonna have the courage to bite into that corn on the cob. And you know what? It brought back many fond memories of that wonderful, delicious summer food. And then I really got up the courage and bit into a carrot It was amazing. These implants have totally made a major difference for me.
I have never had so much confidence in my smile since I had my procedure done. I spent 16 years in partial dentures and I always lacked that confidence, and I wish I would have done it sooner because I love smiling.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. We're talking about no more dentures today. According to my first guest, he's an oral surgeon, and he, is the Central Illinois' go-to surgeon when it comes to dental implant dentistry. We're talking to Dr. Nathan Schroeder. Dr. Schroeder, welcome back.
Thank you.
Now, we've looked at some of the videos, happy patients that are willing to say nice things about you, and you say this is typical.
It is typical, yeah. And this is the result that obviously we're striving for, but it's what brings fulfillment to you as a surgeon, as a doctor and provider, when you see these outcomes and you see people's lives change and you see them happy with their smile and their teeth and they're able to eat what they want and they're able to socialize confidently. That's the rewarding part of what we do.
Do you believe that people with bad teeth, and I think we've discussed this, people with bad teeth are judged? Like people think they're poor or unclean or dirty, especially in Hollywood. What do? You want to make somebody look poor, you give them bad teeth.
Yeah, I would say that's absolutely true. And like I say, it's an unfortunate stigma and that I think affects people negatively in other aspects of their lives. And we have the ability to help change that. A lot of times these people, there's biologic circumstances that are beyond their control. They're more prone to decay. They're more prone to gum disease. They've been negatively affected by things they can't control, just like there's people that are negatively affected by things like heart disease and diabetes.
Okay.
So, we're not judging a patient just because of their appearance of their smile. Even though society may do that, this is a place where, we can come and, scientifically assess that, but at the same time, understand socially where the improvements can be made and what we can do. There's a solution for you if you're one of these individuals.
Okay.
And you don't have to feel judged. You can come in and be in an environment where we've seen this before. I guarantee you, most patients come in and are self-conscious and will say to me, "Doctor, I guarantee you, I've got the worst smile you've ever seen."
Okay.
And 99% of the times that is absolutely not true. In almost every case, I've seen something worse.
Because I looked at some of your photos. I've never seen some of these bad teeth. Is that common?
It's very common. And I think what happens is patients become very adept at concealing or hiding that.
They never smile.
Right, because of the things you've just talked about with Hollywood and society, and they're made to feel less about, so they socialize differently, they interact, they're maybe more reserved, they don't smile in social settings, they keep a closed-lipped, perspective when they're talking, and maybe some of those things then are miscued by people that are receiving those correspondence or communications from these patients because they think they're being standoffish or they're and it's just
or serious or in a bad mood or whatever.
Right, but it's not that at all. It's just they're self-conscious about
their
teeth.
Can you spot it? Like when you're out and about, do you know who's hiding their smile sometimes?
I can see it. Yeah. And so it's disheartening to see that when we know that there's a fix for that, and it's actually very straightforward and can help a great many of these individuals.
Okay, good. Now I know you deal with a lot of older patients. You have patients in their 30s, 40s, 50s. You brought some photos. What are we looking at?
This is a patient who, through another medical condition, had some very severe acid erosion of her teeth. And even though that condition had been treated and resolved, the aftermath of that was something that left her, again, without any molars, with teeth that had extensive decay. She was very self-conscious about her smile. She had difficulty enjoying a full diet. And this is a woman in her 30s. That's a tough thing.
So her options were dentures?
Her options, she was, at the time I saw her, she was wearing partial dentures.
Okay.
So she was already in a form of a denture. Okay.
That's way too young to be wearing a denture.
Any age is too young to be wearing a denture. In my opinion.
Okay, good point.
So she came to see, what we could do for her, and this was a solution with the implants and the full arch type of restorations and prosthetics that we can now offer, where we were able to take her from that, hopeless, miserable solution and facing the prospects of complete dentures at a very young age, and put her into fixed teeth that look like this.
Wow,
And,
very nice. She looks happy there.
very happy, and and she's living a full and complete life. She's a great mom. She's got beautiful daughters. She's got a handsome husband, and they have a great life, and she enjoys everything that anybody with full healthy dentition enjoys. So, and when you look at that picture, you see not just a pretty smile, but you see how everything works in harmony. The lower lip cradles the upper teeth as it should. She's got nice, white, straight teeth. She can smile happily and confidently. And honestly, she's probably a little bit used to being a little more reserved with her smile. So some of that smile and how patient, it will evolve. And
So she's not smiling as big as she probably will end up smiling. Is that what you're saying?
Correct.
Okay.
She's got to lose some of those old habits still. But patients, as they become more confident about their smile, so as her kids, her daughters compliment her husband compliments her, her friends and neighbors, there's a confidence, and it becomes the new normal. And patients forget about those old habits of guarding those, ugly or partial denture teeth.
And now they do selfies on Facebook, we jokingly said, and then they get defriended for being the annoying person that's always taking selfies.
Right.
Because they're so proud of their smile, right?
Correct.
So you have more photos. What else are we looking at?
Okay. This is another patient, also female, who had lost her teeth at a very young age. And then had been in dentures, but had gotten to the point where the other thing that happens, people don't understand, when they wear dentures for a long period of time, the bone and the gum tissue that supports that denture, it withers away, it resorbs, and it becomes what we call atrophic, and it just it will no longer support the denture.
Okay.
And so she had those proverbial nightstand dentures, wouldn't stay in, hated them, was miserable, had been told there were no solutions for her because she didn't have enough bone. And again, this is where the skill set of oral surgeons really comes into play, because we can address those issues and we can give her a brand new set of teeth. Her option of a denture just is not acceptable. It's not viable. We can do
That's why she went to you.
something better.
Wow. Doesn't even look like the same person.
Correct.
That's got to be 10, 15 years younger looking person.
Right.
Looks like she could be the mother of that person.
Absolutely, and you see that, and those are the kind of compliments
Nice.
that she gets. Her own father actually made that compliment to me, like, my daughter, when they would go out together, sometimes, would get asked, is that your girlfriend? Is that, now the distinction is clear. It's definitely his daughter. She looks 20 years younger.
And she looks more attractive in the after. When somebody smiles, they're more attractive.
Yeah, and she
just looks good.
She was, and I should point out here too, this isn't like plastic surgery. I mean, she was always attractive. All we're doing here is restoring her natural beauty. This isn't trying to take something and make it look like something it's not. It's not something where patients have to feel like, I'm trying to mask who I am. We're trying to restore who you are, and this does an amazing job of doing that. And it's not just that the reason they look younger is because the lips and the lower face has the support that the teeth are designed to give it. Look at these photos here, Randy.
That's her profile?
That is her before. You can see the collapse and the breakdown that has happened from that early loss of teeth. This is after the teeth have been replaced and restored properly.
That's dramatic.
Absolutely.
I mean, she's got to be thrilled about that.
Right.
Like, do they even know what they look like on the profile shot?
Well, they know because we show them. And I think with time, looking in the mirror at home, patients pick up on these things. They maybe just don't know how to articulate it and what the terms are. But when you show it to them, they all readily accept that this is something they've been self-conscious of for years. And when you can take and give them back what they should have and what is really their natural state and restore that, it's a big, impactful thing.
If people knew how good this was, right? And you're in Illinois, if all the denture wearers, if all the people that were headed to dentures knew how good this was, there's not even enough oral surgeons out there to handle it.
That's
right?
absolutely correct.
Okay. And if there was like a try-in, hey, denture wearers, come in, try a brand new set of teeth that don't come out of your mouth over the weekend, like as a trial. I know that can't be done, but nobody would go back, right? Nobody would go back to their loose-fitting denture.
I've never had a single patient in the hundreds of cases we've treated who say, I wish I had never done this, or I wish I could go back to my dentures.
Okay. Now people need to, something I learned from you is that many times at other centers, they are left in a denture while they're healing. you don't leave people in a denture while they're healing. You give them teeth that don't come out.
That's
Is that
correct.
right?
That's correct. Yeah. Now we're
Is that
always
just technique? Is it different philosophy?
well. I think when we talked earlier about technology, having that digital preview, knowing you have adequate bone, knowing you can get those implants positioned where they need to be before you even execute the surgery, really helps ensure that happens. Very infrequently. I do have to be upfront, however, and say there are, and we always tell patients there are circumstances where even in our center, you may have to temporarily wear some type of removable prosthesis during a brief phase of healing after surgery. But that happens probably in less than 1% of all the cases we treat. It's much more rare.
So we're out of time. Final message. Somebody watching this, and they've heard what you had to say. Maybe they're wearing a denture, spouse is wearing a denture, or they're headed to dentures, but for whatever reason they're afraid, they're still scared. What do you say to them?
Yeah, I empathize, I understand completely, but be rest assured you don't have to be scared, you don't have to be afraid. There's a solution for you. All the experience and expertise and technology is right here, right now, and we have compassionate staff, we have excellent trained doctors and skilled surgeons we can bring you in and we can get you taken care of, and you can be confident that you're going to get the best level of care.
Now, oral surgeons, because you do a lot of medical stuff, a lot of dental stuff, you charge consultations, and I put you on the spot in my green room. If they mention this show, could you give them a free consultation?
You bet.
Okay,
we
good.
could do that.
Good. Now we should mention, even with the best dental insurance, it only covers a very small portion of dental implants, and Medicare, Medicaid doesn't cover it at all. So what's the answer here?
That's correct. Financing, and that's how the majority of our patients approach this procedure. Absolutely, yeah.
Good.
I mean, we have the ability. We can run a credit score. We can work with various lending programs. We have some in-house financing options. There's a multitude of options, and patients can get great financing. They can pay for everything. Again, it's all under one roof. They can pay for it with one fee. And they can get the work they need.
I have to ask you this. Does it cost more to go to an oral surgeon, a specialist, to get this done?
Well, the knee-jerk reactions say it should because we're better at it, right?
Okay.
But no, it doesn't. And the reason is we're better trained, we're more efficient, we provide these procedures on a regular basis. And on top of that, patients get the highest level of care. They get it done right the first time.
Okay.
Some of the more expensive cases I see are patients where we're maybe having to redo things and replace implants and fix mistakes. And so there's always a savings and a value in getting the best level of care and getting it done right the first time.
I'm going to put you on the spot again. You told me in the green room, you said, we know what the other guys are charging and the big names are doing, and we're a little bit less.
That's true.
In most cases.
I have patients, obviously, that come for second opinion, and they've gone to a bigger corporate type implant center, and they bring in the treatment plan. And most of the time, we're very competitive, if not less, than those treatment plans I'm looking at.
Okay, good. I want to thank you for coming to the show. Good stuff.
Thanks for having me.
All right, thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.